Welcome to Leaders of Tomorrow, India's only daily platform for small businesses. We bring you the right information to empower you, the MSME entrepreneur. Tonight on the show, two game changers. First up, from the education space, that's going to school, and later on, Care 24 is in focus. Going to School is a Mumbai-based non-profit organization that encourages children to stay in school. From design thinking to different activities, this program ensures that it's imparting entrepreneurial skills to school-going children. Mansi Chokse has more.
According to a UNESCO report, about 47 million children in India dropped out of school in 2016. Various social and economic factors contribute to these figures. A Mumbai-based non-profit organization, Going to School, is determined to change this by using the power of storytelling to inspire children to stay in school. Going to School aims to create an impact in the lives of young children in rural and semi-urban areas through books, movies and games. Reaching out to 4.5 million students across the country, they organize activities and competitions in state-run government schools, which aims to develop a penchant towards interactive learning.
The idea of going to school came out of how I grew up, which was moving around the world quite a lot to different schools. So every time I went to a new school, kids would ask me, what is it like to go to school where you went to school? And this was before the internet and before you could kind of Google or check out what it was like to go to school, for instance, in India or in Italy. So I had trouble explaining that it was different, but it was the same. And I really wanted to be friends with these new kids that I was meeting, but I couldn't really describe where I had come from. Then flash forward about 7 or 10 years, suddenly I was a teacher. And so the roles were reversed. And I had a class of 16 6-year-olds in London. And I had taught my class about Mexico, because I had spent a lot of time in Mexico, so I could do that. But when I wanted to teach them about India, I couldn't find anything at that time. And this was kind of like 1998, so kind of a long time ago now. And there was a little boy in my class who asked me, what is it like to go to school in India? So here we have me, who was suddenly a teacher before I was a kid, and it was the same question that children were asking. So it gave me an idea to think that perhaps we could tell stories to inspire kids or enable kids to understand each other wherever they are in the world. And that's where the idea of going to school came from. I then moved to India because I wanted to answer Oliver's question, which is what is it like to go to school in India? And I started off by working for UNICEF and traveling across India writing stories for adults. And it was at that point again that I had kids always asking me, what is it like to go to school in Kashmir? What is it like to go to school in Tamil Nadu? What is it like to go to school wherever I had come from? So it was the same question across so many years and now different countries that I thought, wow, stories can actually become that connect, become that glue, enable kids to understand each other. And then stories can do even more in terms of making education relevant to children's lives.
Associated with 4,500 government-run primary schools, this organization reaches more than 1 lakh students every week. They curate stories and orchestrate weekly activities to make mundane lessons more engaging.
So all of our stories are about solving big problems. So what are the big problems that kids have right now growing up in India if you're going to a government school? What is bothering kids? And how do we therefore design stories that enable kids to understand that they can change the way things are? So all of our stories are taking on big issues that are important to kids. Why is there garbage in the street? Why is electricity going off in my house? How does solar light enable the lights to stay on? What is clean energy? What is sustainability? What are the role of girls and women in changing everything in India? So our stories are always about young women and young men, girls and boys, who are using their entrepreneurial skills to change the way things are, where they are at school or in their communities. So our stories teach 21st century entrepreneurial skills, but do that through an experience of storytelling for children.
This organization runs a number of projects to encourage skill development and promote entrepreneurship among school children. They not only encourage children and youth to come up with business models, but also fund them.
Okay, so our biggest program is called Be an Entrepreneur, or Be Schools. It's got many names. We've been running that at scale since 2012 in thousands of government schools in Bihar. We chose to do this in Bihar because the government was very excited about the chance to make a difference in secondary schools with what they consider to be skills development. We call it the power of stories. They are stories that teach children skills, 21st century entrepreneurial skills, how to identify a problem, take initiative, make a plan, how to work in a team, moving all the way up to graphic novels of young women starting solar enterprises or even learning how to drive a tractor. So our entire program is a skills development program. It's powered through content. So every week kids are given a story to keep and take home. Together they play a board game or a card game in the classroom, which is a business plan game or a marketing game. And then outside of the classroom, they complete a skills challenge project, which is where they go out into their communities and they might do an energy audit of 10 households to find out how would those households make a switch to solar light, or they figure out what can you make out of what other people are throwing away. And they complete those projects, and our team goes and collects them and grades them and logs them to a central system. So when we started Be an Entrepreneur in schools, Anjani Kumar Singh, who was the principal secretary then, said, well, it's wonderful, we're teaching kids entrepreneurial skills at school, but what happens next? What happens when they complete grade 12 and they go out into the world and perhaps they can't get that startup capital that they need to follow their new idea? And so we looked at everything and all the different kind of programs, things around, and we realized that he was right, that in fact that a young person coming out of a grade 12 government secondary school would probably find it difficult to get a loan or a startup capital investment to start a new idea. So B Fund, or what we now, how do you say it keeps changing its name. Today it's called the Climate Change Fund, works in the same communities in Bihar as Be an Entrepreneur, Be Schools. So you have kids learning skills at school, and then you have a set of startup grants that young people aged 18 to 25 can apply for to start a business that solves a problem where they live.
Going to School has opened India's first kids news service under the name Scrappy News.
Sound rolling.
Rolling.
Camera rolling.
Rolling.
Light. Camera and action. Hello. Scrappy News में आपका स्वागत है.
In these colourful news studios made out of scrap, child anchors and reporters put together their own news bulletins. Scrappy News encourages school children to take cognizance of the social or environmental issues around them and discuss the same on their news bulletins.
Hello. 100 million and change. The big problem we are going to solve is that the world is a mess.
Thanks for that.
मेरा नाम फौजिया है और मैं 9वीं कक्षा में पढ़ती हूँ। मेरी समस्या ये है कि लोगों के घरों में पानी कम आना। जब बारिश होगी तब मैं वो पानी को इकट्ठा करूँगी, उसे हार्वेस्ट करूँगी, वो पानी का इस्तेमाल करके लोगों को 15 रुपए लीटर से दूँगी।
So the Children's Scrappy News Service, I always have to make a big disclaimer about it. So I'm completely in love with it. And it has come out of everything that we've been doing for 15 years on the ground in schools in Bihar or across India. It's our lessons learned taken to scale. The Children's Scrappy News Service is a news talk game show run by two kids that are robots in a newsroom made of junk and once loved things. It is a primetime television format where kids take on and solve bigger problems according to them. So why is there no place to play and why are girls not playing? How do we get every dog a job? Let's recycle everything. How do families make the switch from, how do you say, from electricity to clean energy? Grandparents crossing the road. It is a good news show run by kids for kids. So the kid anchors are in the newsroom, which was in the Worli fishing village in South Bombay. They then connect to their kid reporters who are across India, mostly in Bihar and in North India, who are interviewing adults on the street about why this problem exists. So why is there no place to play for girls and what can we do about it? Then they spend the afternoon when they find a scrappy hero, someone who's got a solution, like the girls who play with Yuva in Ranchi and Jharkhand, and they'll go play football with girls who are making a place to play and making an answer to their question. And then it's back to the newsroom where they launch a Scrappy campaign, which is where you can download the app if you're a kid, or you can text back and forward to the bot, and you can join the Scrappy campaign wherever you are in India. So it is a platform for skills, for children, but also families and parents. It runs across platforms. It's on primetime television, digital mobile, and then on the ground in schools. It is everything we've learnt for the past 15 years rolled into one little wonderful scrappy idea. For us, anyone can be scrappy, which means to create something out of nothing with whatever you've got. You don't have to speak English or be online, but you do have to believe that you have the chance now to change the world, and we need kids to take that chance and to make things different now.
The organization works with state governments and partners with global organizations like UNICEF to reach out to children in rural and semi-urban areas.
So we are who we are today because of the state government of Bihar, the government of Bihar, who when we first went to go meet them, we suggested that perhaps we could work in 100 schools to just roll out our Skills at School program through stories. So it was overnight that we went from, I would say, just a content creation kind of company or not-for-profit to implementation, which we had never done before. So we began with training teachers, doing teacher training, then printing and delivering the books, and then monitoring what happened every week in terms of skills.
The team visits multiple small towns to run impact-based initiatives that touch a chord with young children. Initiatives run by Going to School are an attempt to generate awareness about environment and health, creating a huge impact on the lives of rural children.
Time for a break. When we come back, Care 24 is disrupting how you treat your loved ones. More when we come back. Welcome back with us here on Leaders of Tomorrow, and tonight we're talking about the healthcare space with Care 24. Now, when a loved one falls ill, along of course with the worry that comes with the illness is hospitalization and the number of procedures that are involved with it. But what if it was possible to treat your loved ones at home without a deterioration in the quality of healthcare that's being provided? Shubhangi Sinha caught up with the female founder of this company to bring you more on how they're disrupting the healthcare space. Care 24 in focus tonight. Take a look.
On any given day, you and I would know where to find a cab, how to satiate our hunger, and perhaps what events and movies we should be going for this weekend. But if you were to ask me how to find a nurse or a doctor to take care of an ailing one at home, I'd be quite frankly clueless.
Well, up until we at Leaders of Tomorrow decided to dive deeper into the world of home healthcare through the story of Care 24, a company that's bringing quality treatment and care center stage.
I'm Garima and I am the co-founder of Care 24. It's a home healthcare company. We are operational in Bombay and Delhi for last 3 years, and we have served about 50,000 people in Delhi and Bombay. We are big time into training, so we have trained 5,000 people in Delhi and Bombay. It's funny because I'm not a doctor, I'm not a surgeon, I don't come from healthcare background. We started this 3 years ago because that's when I had moved back from US because of some family reasons. So I graduated from IIT Kanpur in 2010, and after graduation, like most of the IITians, I took a job in consulting and I was at Deloitte for 2 years. It was great, it was a great learning, but it did not do what I wanted to do. It did not make much sense, and I took a break. I was in States, but I came back because of family reasons. Like my father has been a cardiac patient for almost a decade now. So, and that has changed us, like all of us, like my family, everyone in my family, and the only thing that we seek is actually good health. And that importance, when you see all otherwise in the world, you don't see it in India. People don't take care of their health. Health has become a reactive thing. You know, you go to a hospital only when things go terribly wrong. You don't go every day just to know that you're doing fine. You don't go even after surgery to know that you're doing fine. We are, as a nation, we are, I think, irresponsible towards health. Some of the reason for that, I think, is also because we have the best doctors. We really do a bad job. We eat bad food on the street, but the doctors treat us, and we think that everything is fixable. Unfortunately, everything is not fixable. And that's where I guess Care 24 came in. Because of what I had seen in my family, I wanted to do something in healthcare. And to be honest, I had no clue what I would do. Like, I just knew I want to do something in healthcare. I want to improve the quality of care that we deliver here. Luckily, that's when my co-founder Vipin also met me, and we discussed that he was planning to do something in health, and I think that's when we started, okay, let's do something in health. What is that something is what we have figured out probably, I was still figuring out in 3 years. So we started in December 2014, and we did a lot of health camps in Bombay. We went ourselves, we took a nurse, we did morning health camps in societies, at least in 500 camps, 500 societies. And we just talked to people. We just asked them, what is the thing that you need the most? How is your health? What do you think about health? And we were surprised that a lot of people don't even know about their blood pressure. We were surprised that a lot of people just struggle to get simple injection at home. Like, people go to the nearest hospital for an insulin injection. That was mind-blowing. Like, no, this can't be happening here. You know, we have the best doctors, we actually have good nurses, we have good nursing colleges in India. Then why is it that these people still have to struggle to get that care, struggle to go to the hospital for such a simple thing? Let's build a platform, let's build a company where people can get nurses, people can get physiotherapists, people can get good caregivers who are reliable, who are professional, who are trained, and who will do the job at home. We wanted to save customers time, customers money, and we wanted to give them a much better healing environment. The tripod that I think on which Care 24 is functioning well is the technology that we have built, the caregiver training that we do, and the customer feedback that we continuously take. This system ensures that everyone gets the best care possible.
By 2050, the elderly population in India is expected to account for 20% of the total population of the country, presenting a large opportunity for the rapidly growing home healthcare market, which is estimated to be $6.21 billion by 2020.
Now we have progressed a lot into cancer care, palliative care, post-surgery care. There's so many things that can be done at home, and our idea is to do all of that at home. After a major surgery is done, in fact, even after, even the patients who are in ICU, they don't need to stay in ICU for that long. There are other customers waiting to get in ICU, first of all, and that's a problem. And secondly, you're paying at least 20 times more than what you need to pay when you're at home. It can be done at home. And I've done it for 3 years now. I have met the experts in the field, and we know the components are very simple. The devices are same in hospitals, the devices are same at the home. The nurses are same, the nurses are same here. So everything is very easily available. It's just about building a technology platform that can put it together and give it to the consumer where they can trust it and understand it. And it cannot come at a very high cost. So the other key factor for us was to maintain this affordability. I think that what we have done is we have reduced the cost for our consumer. We have reduced the number of readmissions. We have reduced the number of falls. You won't believe elders have a big problem of just falling. They don't know how to maintain the body balance, and I think that's what we train our caregivers. That's what we train our customers also, how to be aware of this problem, how to change the house when the age changes. You know, how to change the surrounding, the environment when, let's say, dementia sets in. You know, you are more forgetful, you're more agitated, so you need a different type of compassionate care. So what we are doing with help of training, feedback, and technology is trying to deliver a very patient-centric plan. You know, every patient is different, every caregiver is different, every house is different. How do you deliver a care that works for everybody? And I guess that's what has been the learning, that is the journey to make a company that knows the patient, that knows what training it would take for a caregiver to deliver those needs, and that ensures through technology that all of those adherences are met. Even our attendants who are there for 12 hours, they maintain a checklist of what all they have done with the patient. Simple things like whether they cleaned the patient's room or not. Simple things like whether the patient took 3 meals in a day or not. So we do this. The future, I think, is that everything can be done at home. Easily, it can be done at home. The infrastructure exists, the people exist. But what we need to develop is the trust. What we also need to develop is awareness, consumer awareness, that why you're going to the hospital if same thing can be done at home. and consumer awareness to question if he thinks that the quality is getting compromised. If I as a consumer know about my all other services, I know how the car was fixed, for example, but I don't know if the doctor did a great surgery or not. I don't know if the nurse did a good dressing or not. And I think that is where the opportunity lies, where the customer is very educated, to make these companies that make very affordable healthcare devices, and to have companies like Care24 and Medwell and Portia's of the world, which take these devices, bring remote monitoring at home, so that you can be rest assured that the patient is getting the best care. The future will only happen when you are getting 12-hour data and you can take a data-driven decision. What we're trying to do is build this ecosystem where the consumer is more aware, where the healthcare services and products are a lot more affordable, and where the doctor, the patient, and a technology company can collaborate to ensure much better patient care at home.
Marrying technology, quality care, training, and a passion for competitive home healthcare, Care24 is bridging gaping holes in the Indian healthcare industry by helping patients heal in the comfort of their homes.
That's our show tonight. If you want to be featured here on the show, like either of our game changers, or you have any companies that you think would be a good fit, here's how you get in touch. leadersoftomorrow@timesgroup.com is our email ID. You can also reach us on social media. Sunanda_J is my personal Twitter handle. LOT_ET now or Times Influence are our official Twitter handles. You can also leave your comments for us on our Facebook page, Leaders of Tomorrow on ET Now. Thanks for watching. Have a good night.